So welcome to our three-part web series. Our mission is educating you on the power of using experts to help you decode Medicare, long-term care, and elder law issues. When you are empowered with accurate and efficient information, you can protect your family well, spend your healthcare dollars well, and remain calm and confident in your daily lives. The group of experts we have for this series include Keith Knabb of Affordable Medicare Solutions, Sabrina Scott of Red Feather Financial, and Shannon Pauley of the Estate and Asset Protection Law Firm. Each expert will highlight one area of information in each 15-minute segment. Today, we will hear from Keith Knabb on making Medicare work for you. Our second segment will be hosted by Sabrina on the long-term care market. Our third segment will have Shannon teach us how to be accurate and legally ready for a healthcare event or untimely passing of a loved one. Keith Knabb has been helping families and seniors for 25 years to navigate the medical plan market. Medicare is not set it and forget it. Keith's staff of 9 employees manages the Medicare plans of thousands of Georgia seniors. Keith, please introduce yourself to our audience.
Thank you, Sabrina. I'm glad to be here today. Affordable Medicare Solutions was founded 25 years ago, and we have grown to be the largest Medicare planning agency in Georgia. Our agency does serve thousands of seniors, but even more importantly, we're the largest provider of Medicare education services in Atlanta. I teach at all major hospitals, and I teach nurses, case managers, and social workers, as well as seniors or their adult children who are taking care of seniors. So today we're going to talk about making Medicare work for you. And this is important because Medicare is not something that you set and forget. It is something that you can continually upgrade and improve and make work better for you. The first thing you can do when you have Medicare is you should create now a MEDICARE.GOV account. October of 2019 is when the government improved these online technologies, and it is very, very efficient now. And if you are already in Medicare with either just the hospital portion or full Medicare with hospital and outpatient care, you should create your Medicare login and password. You can then manage your account there, such as printing a temporary replacement ID card, seeing the in-force status of all the Medicare plans that you have, and analyze and select new Medicare plans for the next year, such as the Part D drug program. In the fall, you can see the new plans that would start January 1st. Now, this is very empowering for a family that if there's a parent in crisis, the family can get the information off the Medicare.gov account and know accurately what plans the parent has. So it's really important. So to create this account, you go to MEDICARE.GOV and you'll go to login or create an account. And in order to create an account, you'll need the Medicare ID number. You'll need the correct address and zip code where the person has their information registered with the government, and put their Medicare information in there. Then you will create a security question. You'll create a login and password. And it takes about 5 minutes at the most, maybe even only 2 or 3 minutes. Once you've completed all of those things, the next thing you do to manage Medicare is to understand that Medicare is not one program. Medicare has different avenues that you can access Medicare through. And this changed in 2005 with the Medicare Modernization Act. So from the last 15 years, Medicare has created 2 paths to access. They left the traditional Medicare path, and they also created a new HMO or PPO Medicare section called Medicare Advantage. Understanding this difference between the 2 sides is vitally important. They are very different. Of course, I can send you information from our Medicare ebook. It's a 10-page book. And I also have educational flyers that understand these 2 pathways. I teach a 1-hour class to professionals and families about this situation. So basically with traditional Medicare, you can prepay for your medical events by purchasing a simple small insurance policy called a MEDIGAP or Medicare supplement policy. And basically with modernized Medicare, you will pay as you need care, pay as you go for your medical events. The trade-off is not altogether ends there, because you do get extra benefits. You're going to get thousands of dollars in extra benefits under the new modernized Medicare plan to help offset some of those other costs. Let's go over what that means. The extra healthcare benefits that the government has authorized for the new plans to offer include, often will have a dental component, maybe even up to a couple $1,000s of dental care per year, vision, eyewear, eye testing, glaucoma testing for free, and sometimes some of the plans will pay for hearing aids or provide them at a low cost. Medicare doesn't do any of these things, but it's allowing the companies to provide those benefits. One very popular benefit is gym memberships. You can go to the gym, LA Fitness, for free. Or you can have WellCare incentive payments that'll pay you to go get your annual exam done, or to do other things such as volunteering in the community. There's lots of innovative programs. A lot of plans today will also pay for over-the-counter medical items for free to be delivered to your home. So maybe Medicare doesn't cover vitamins, but the plan will provide them to you for free. They also are doing something new today, which I think might become a part of Medicare permanently, is meal delivery to your home after you've been hospitalized. It's kind of funny, they'll feed you at the rehabilitation center, but when you get home, they've never fed you. Well, they're experimenting with that right now to deliver 14 meals to your home. If that helps you get better, it's a great idea. There's also possibly other benefits on a very small number of plans, such as home care assistance or medical transportation benefits to get you to the therapist or the doctor and help you to stay healthy and get your stay in compliance with your doctor's orders. Now, you don't necessarily buy a Medicare program just to get those extra benefits. So let's talk about why it's important to consider a MEDIGAP supplemental insurance plan. These have been around for over 40 years. And this is where, if you don't want to go to the new side of Medicare and you want to stay within traditional Medicare, you can buy a MEDIGAP plan, and it is wonderful. They cost very, very little, $130 to maybe $230 per month. And this plan will pay for what Medicare leaves behind. Those are deductibles, the co-insurance, the large costs of cancer treatments. The supplemental plan will pay for that. And it gets to make no decisions on your health care. It just lays in the background waiting for Medicare to do its thing. Medicare makes the decisions, and Medicare instructs the supplement plan electronically to pay the rest of the bill. Your hospital and your doctor do not need to join a network to be paid. They love that. And these plans have been around, like I said, for 40 years, so it's very consistent and simple. And your coverage will not change throughout the United States. When you have a plan from Georgia and you're in California, the coverage is not changed at all. Now, when you have an annual review, which every person in Medicare should consider doing, these annual reviews do matter, because you don't want to find out in January that your drugs or your pharmacy is not covered. You want to make sure that your doctor and hospital are covered. You don't want any ugly surprises. So you can look in October and November and investigate on your current plan to make sure it's going to work for you next year. And you need to make sure that you're not being overcharged for any of your plans. Typically, the drug programs will start out low price, and we've seen them creep up every year in a sneaky way. They might start at $15, and then 3 years later, they're $50 or $70 or $90 per month. So you don't want to do that. The average cost of a Medicare drug plan has stayed around $35 a month. And in Atlanta, even less than that, less than $20 per month. You need to be advised on any new Medicare rules that are going to be upcoming. This year on January 1st, we had a lot of new rules that were implemented that were confusing for some families. And I had to explain why a husband who had turned 65 in 2019 had different options than the wife who turned 65 in February or March of this year, 2020. You need to tell your Medicare advisor agent about any upcoming life events, such as moving. If you're planning to sell the house in Atlanta and move to your house in the mountains, you need to have that conversation before you make that move. So what if you mess up and you do not take care of your Medicare changes in that fall enrollment period? That fall period is kind of short. It's October 15th to December 7th. And the reason they choose the 7th is so that if you enroll in a plan, it gives the company 3 weeks to print your ID cards and get them to you in the mail. They want you to have them in your hands to use on January 1st. Now, if you forget to do it then, in some of the plans, the HMO and PPO options can be fixed in the first 3 months of the year. This is a new period started in 2019 that was called the open enrollment period. So if someone on a very restrictive HMO that has a small doctor network finds out their doctor has left the network, they can call me in January, February, or March, and I can simply move them over to an open access PPO optional network plan. Makes it very simple. I can move them to the first of the next month. If you have a special exception, such as a move or a dramatic income change or a loss of a spouse, or maybe you've gained one of the federal subsidy programs to help you with prescription drug costs, those can create special times of the year with a 60-day event rule where I can fix your Medicare. And finally, the MEDIGAP insurance supplement plans don't have to worry about these annual periods and these special periods. The MEDIGAP insurance plans can actually be changed any month of the year. And that's very helpful. If someone calls me and said, hey, Keith, you know, I'm not your client, but my friend said you could save him $100 a month, and you did. And then they said, can I do that for myself? And I will help that person to find a new plan at a much lower price. Very common, and it can be done any month of the year. Now, there's all sorts of things that have happened this year, such as related to the coronavirus, telehealth services. Most plans are going to allow you to have telehealth services. Medicare has relaxed that rule and will pay for those visits and will allow you to virtually speak with a doctor, such as with your cell phone on FaceTime or just a phone call, or through other teleconference methods. You can also take advantage of the over-the-counter medical items delivered straight to your home. And also many plans have home fitness programs that they're providing because the gyms are closed. So you can go online and watch a teacher and do your exercise class in your living room. You can also get early refills on drugs from your pharmacy. The state of Georgia helped out on this and said most drugs, you can get a 90-day refill. You know, obviously those drugs that are controlled substances, they were did not provide the same 90-day fill. And you should never pay fees for coronavirus testing. And that includes infection testing and also post-infection testing, which is the antibody tests that are going to be coming out. Those things are going to be covered. Most plans should cover that at 100%. You should not pay a fee to have drugs delivered to your home. And a nice rule that has been relaxed or suspended is the 3-day hospital rule. Now, hospital stay rule was attached to original traditional Medicare. The new side of Medicare, the HMOs and PPOs, never had this rule. But under original traditional Medicare, you had to stay in the hospital for 3 days in order to be qualified for rehabilitation care at the skilled nursing facility. Well, they got rid of this rule during this crisis because they wanted to free up beds so that they would get as many people out of the hospital in case there's a surge of patients, an outbreak in your area. Very smart move. Now, are all Medicare agents the same? Absolutely not. Unfortunately, most Medicare agents are set it and forget it salespeople. Only a small percentage of Medicare professionals provide actual annual management and year-round advice and service. Need a large staff to do that. And most Medicare agents are a one-man band, a one-man shop or one-woman shop, and they don't have a staff of 7 or 8 or 9 people to be able to help the clients. You should also be careful on this one. Only use a Medicare professional that will show you all of the options in your area and not just a select few that they like. I'll give you an example. Most agents will say, oh, I am a broker. I represent multiple Medicare plans. But actually, there's 40 or 50 options in your county, and they might only show you 2 or 3 rather than showing you all the options that are available. And this one, finally, is really important. Only use a Medicare agent that provides all of their services at no charge to you. Affordable Medicare Solutions provides all of our enrollment services and annual services to our clients at no charge. The families love that. I appreciate you joining with us today. We do offer the free Medicare planning services. Our phone number is 770-945-5261. And to request a copy of this presentation, please contact Raquel at amsplans.com. Sabrina, I'll turn it back over to you now.
Thank you, Keith. That was very interesting and certainly timely information. Families need your service for sure, and that you do all of this at no charge is a blessing during this challenging time. You can see this presentation on Keith's YouTube channel, or we can send you these slides by emailing keith@amsplans.com. Also, Keith has a wealth of educational material for free download at his website, www.amsplans.com. Next week, we will be educated by Sabrina Scott of Red Feather Financial. She is an expert in long-term care planning and funding. You don't want to miss her innovative ideas and creative approach. Thanks for viewing today.